which is the base where the major blood vessels are. And they include the superior vena cava, the ascending aorta, which gives rise to the arch of the aorta. The arch of the aorta gives rise to the brachiocephalic trunk, left common carotid, left subclavian, and then the descending aorta. At the pointed part, the apex, that's the pointy part, that's where both ventricles meet. So you have your apex, you have your base, and these flaps here are the auricles, which are appendages over the right and left atrium, which are the two superior chambers of the heart. Atrium, ventricles. Then we have this yellow represents fat. So this depression here, exposing the left coronary artery and the great cardiac veins, are sitting in a depression that's called the interventricular sulcus, meaning between the ventricles. And over here, that goes around the heart, all the way around posteriorly. You can see the coronary sinus, great cardiac vein, all that sitting in a depression that's called the coronary sulcus. So the coronary sulcus separates the atriums from the ventricles, and the interventricular sulcus separates the right and left ventricles. Now inside, you have the four chambers. You have the right atrium here, which is receiving blood from the venous return, which includes superior vena cava, inferior vena cava, coronary sinus, and the anterior cardiac veins in blue. All that drains into the right atrium. The right atrium is lined with smoother muscles, not smooth muscles, cardiac muscle, but smooth in appearance, called pectinite muscles, little ridges inside the atrium. And there is a valve on the right side called the tricuspid valve. Now, inside the right atrium, you can see superiorly, you have the pacemaker. This is the SA node that spontaneously depolarizes how many times per minute?
60 to 100.
No, you answer first.
Sorry.
On average. About 75 times per minute on average, but it has a range. The depolarizing wave travels through the AV node here to the bundle of His and then separates to the right and left bundle branches. That is the conduction pathway. But the pacemaker, although each of these are pace setters because they do depolarize spontaneously, but the pacemaker depolarizes at a faster rate, therefore superseding their ability to set the pace of the heart. So inside here, there's an oval depression called the fossa ovale. This in utero is opened, allowing blood to flow from the right atrium to the left atrium, circumventing the right ventricle, which pumps blood into the pulmonary circuit. In addition, since we're talking about redirecting the blood flow in utero, you have the ductus arteriosum, which is open in utero, allowing blood to be shunted from the pulmonary trunk to the aorta. And in the adult, it's the ligamentum arteriosum. So it becomes a ligament, not functional, but in utero, its function is to allow blood to be circumvented away from the pulmonary circuit. Now, back to the right atrium. The valve here, which is the tricuspid valve, is attached to these tendons called chordae tendineae, which are attached to the papillary muscles here and here. Now, when there's a depolarizing wave traveling from the interventricular branch, terminating at the Purkinje fibers at the ends of them in the marginal walls of the chamber, it causes depolarization of the muscle, which shrinks, pulling the chordae tendineae, putting tension on the cusp. So when this ventricle constricts and the pressure rises, there's a tendency for blood to flow in the path of least resistance, either back up through the tricuspid valve or through the pulmonary semilunar valve here, shown inside the right ventricle, just above an area called the conus arteriosum. That's the segue to the pulmonary semilunar valve. So with this valve closing, blood is forced into the pulmonary circuit. To prevent retrograde of blood flowing into the atrium from the ventricle, the valves are closed, right? As blood comes up, it closes the valve, and the tendons hold the valve in place so they don't open up into the atrium. So if one of these tendons were to break, of course you'd have a floppy valve, and that could cause some regurg and blood flowing back into the atrium, causing the ventricle to work harder to move blood out downstream. Inside the right ventricle, you have the moderator band, only found in the right side here. I have my finger in it. And the roughened muscle, which is called the trabecula. Then, from the right ventricle, blood advances through the pulmonary semilunar valve here, which is at the top of the right ventricle, and that smooth area, that conical shaped area, is the conus arteriosum leading to the pulmonary semilunar valve that enters into the pulmonary trunk. Now, by definition, arteries take blood away from the heart. They are usually red, and veins return blood back to the heart. They are usually blue. In this particular case, since it's moving deoxygenated blood from the heart to the lungs, they're indicated by a blue vessel. But it happens to be an artery because it's taking blood away from the heart. So it travels into the pulmonary circuit by way of the left pulmonary artery and right pulmonary arteries. When you look at this posteriorly, the right side is right, the left is left. When you look at it from the anterior view, when you're looking at this, don't forget to change the side that you're looking at. So this is the right atrium, but what does it look like to you? That's like a non-kidding answer. I don't want you on the witness stand in my defense. I don't know. He was holding the gun, but I don't know if he pulled the trigger. But even though there's blood all over me, I didn't see nothing. In any case, blood travels into the left and right pulmonary arteries, taking blood away from the heart, and then traveling through these four vessels here that are in red, which are the pulmonary veins. By definition, they return blood back to the heart. The reason why they're red is they are carrying
Oxygenated blood.
say it, oxygen. That's not going to work on the test. You can't. You don't help her.
Oxygen, yeah.
Did you have a happy Valentine's Day?
Happy Valentine's Day.
Did you have a happy Valentine's Day?
Oh, yeah.
I have a happy day every day. Every day I wake up on this side of the lawn. I don't have to call Bill like, I don't have to see people like Bill show up at my door. I'm okay, all right? So blood travels back into the left atrium, and these blackened areas represent that the vessel is patent or open. All right, so blood's returning from the pulmonary circuit into the left atrium, where it travels through the bicuspid valve on the left side or mitral valve into the left ventricle. Again, just like the right side where you have the chordae tendineae and papillary muscles, you have the chordae tendineae and papillary muscles, no moderator band, only found in the right ventricle. Then blood traveling from the left ventricle, when the pressure rises here, the valve closes, and blood is forced through the aortic semilunar valve here into the ascending aorta. Now the aorta, which is made of smooth muscle and elastic tissue, expands and naturally recoils. And when it recoils, the valves here, the aortic semilunar valve, close, forcing blood moving through the arch of the aorta, through the brachiocephalic trunk, left common carotid, left subclavian, and also through the right and left opening of the coronary arteries. At this point, when the ventricles are relaxing, blood flows from the coronary arteries into, from the openings of the coronary arteries, from the aorta into the coronary arteries, supplying myocardium. Then, the coronary arteries. So here's the right and left opening. That gives rise to the right coronary artery here, and it splits. This bifurcation represents two different vessels. The marginal branch supplying the anterior ventricular wall, and the posterior branch coursing around the backside down into the interventricular septum, supplying the posterior wall. On the left side, you have the left coronary artery splitting here to become the left anterior descending and also the circumflex. Left anterior descending supplying the left anterior ventricular wall, and the circumflex coursing around to the posterior wall. The right and left coronary arteries are going to form an anastomosis at the apex, meaning there's collateral circulation to the myocardium by both coronary arteries, right and left. Once the oxygen has been delivered to the myocyte, the carbon dioxide and waste is returned by way of either the great cardiac veins on the left side, traveling around and draining into the coronary sinus, where it's joined by the posterior cardiac vein, middle cardiac vein, and small cardiac vein, PMS, into the coronary sinus, which drains directly into the right atrium. In addition, the anterior cardiac veins also drain into the right atrium, and also the left anterior descending, there's a collateral branch called the diagonal artery over here. It's not in your book, it's on your list.